Morning students, today I'll see about fractured clavicle. I'll see about synopsis. First point, definition. Second point, mechanism of injury. Third point, clinical features. Fourth point, pathology. Fifth point, investigation. Sixth point, treatment. Treatment categories: surgical and physiotherapy. Okay, these are headings I see about fractured clavicle. Fractured clavicle is a critical term. It's most of all is horizontal long bone. This is a horizontal long bone. Okay, this is the most of all the mechanism of injury commonly occurs at the fuß injury, fall on outstretched injury is the high velocity force is occurred at the fuß injury. That occurred the clavicle fracture happen. Then another mode of injury, direct blow on the shoulder joint is a direct blow on the head and the land, that is a fracture of the clavicle. Most of the fracture clavicle come with the shaft of the fracture clavicle. Both three ends are clavicle, lateral, middle and medial end. The most commonly fracture compensated at the middle. Shaft is most commonly occurs. Then dislocation most commonly occurs at the middle end, the sternoclavicular joint. Then mainly happen at the clavicle fracture mainly happen at high velocity fall on outstretched hand. Then direct blow on shoulder. Okay. Then three categories: lateral, middle, and medial. Most commonly occurs the shaft region. Then you'll see about clinical features. What are the clinical features present in the clavicle fracture? First of all, pain over the shoulder region. Pain over the shoulder region's pain. Then swelling over the shoulder joint. Then inability to move the shoulder movements. Shoulder ROM inability to move the shoulder movements. Then you will show. Then we'll go for mainly pathology occurs at the pathology mainly occurs at clavicle fracture. Clavicle fracture is a long bone, long horizontal bone. Then is first we'll see about one is the fracture. Fracture with dislocation is the most rare form of the clavicle fracture. Then this type of fracture most commonly you will see about the conservative management. Then most communicated fracture, that kind of cases will choose for tense nailing plate or buttress plate. These are nailing and plate fixation is done. Then most of all you will see conservative measure see what the figure of eight bandage with shoulder arm sling. This is the conservative measure procedure. Then follow the 3 to 4 weeks immobilization period. Then after that 4 weeks you will move the mobilization phase. Then your investigation phase, you will for the clavicle fracture, you will see about X-ray finding, anteroposterior view and the lateral view. The anteroposterior view is seen about the clavicle region, close region is seen about clearly seen about the fracture line. Fracture line is the extraarticular fracture. The fracture is commonly visible on the X-ray findings. If the intra-articular fracture, the fracture line is seen about not seen about the X-ray findings. A single line of the fracture is seen. CT is a very good investigative procedure for the intra-articular fractures. Then you will go for the treatment aspect. The clavicle fracture first we'll see about conservative management. Conservative management is mainly for figure of eight bandage with shoulder arm sling, cuff and collar sling for 3 to 4 weeks. 3 to 4 weeks. Then this immobilization period, the physiotherapy aspect I will go for exercise or the mainly concentrate on the breathing exercise and isometric exercise. Isometric exercise for the rotator cuff strengthening. These are the exercises for the still. Then elbow, wrist and finger movements are a full range of movement. Full range of movement is initiated. Then we will go for after 3 to 4 weeks, mildly started the pendular axis, short lever is the pendular axis started. Then after the 3 to 4 weeks mobilization phase started, we will go for progressive mobilization phase. This phase of the will start at the elbow and wrist and finger movements are there. Will go for resisted patterns. Resisted movements for elbow. You will see today we'll see about the clavicle fracture. These are the findings. Next class we will move to the another type of the fractures. Thank you.